As far as the Baucus bill, I had heard that it's talking about reducing HSAs. The limits. Right now the limit's $3,000, which is ridiculous. I feel that that's going in the wrong direction, and instead the HSA should be expanded to $10,000 or $15,000 and allow people to choose their own insurance, like I choose my car insurance. And I think basically my overall comment is that government needs to stop tinkering around and trying to fix all sorts of problems. The Cash for Clunkers is a perfect example of ridiculous legislation that put a little Band-Aid on a part of the economy. And the government should stop picking winners and losers. So I would like to see more choice and more competition.
Thank you for your comments. I appreciate it very much. We're going to try to keep things moving because we've got a lot of people on the line. But I think you made some very good points about government just continuing to expand, continuing to get in our lives. We saw that, the first bills that I was faced with was voting in Congress with these bailout bills. Bailing out the financial markets, bailing out the auto industry. And then came all these spending bills with the big infusion of government spending and expansion of government with the stimulus bill. And I voted no on all these bills. I voted no on the budget, which continued now moving from billions to trillions of dollars of spending. And then we went into an energy plan that I believe is terrible for Ohio, the cap and trade plan, or it should be called the cap and tax plan because it's an energy tax that we put on every household in the state of Ohio, and it's going to hurt us in Ohio manufacturing, and because 90% of our energy comes from coal. Again, more government regulation is being put on, and now we're talking about health care, and government now expanding into health care. So I think you make a very good point, and I agree with you as well. I want to point out one area, because you brought up the Baucus bill, and some of the things that are happening in that Baucus bill, including taking out plans like the healthcare savings accounts, the HSAs. The healthcare savings accounts are medical savings accounts that are available to individuals to be able to enroll and take control of their situation by investing in HSAs. So if there is an emergency and a healthcare need, they can draw out that money and use it, but it also gives them an opportunity to save. I was very concerned that those types of incentives are being taken out of the healthcare reform proposals in Washington. I'm introducing a bill today. I've got, I think, 20-some co-sponsors on that bill. It's supported by our small businesses across the country that would not only keep HSAs around, but would expand on it. It would allow more flexibility and give people more of an incentive to want to invest in healthcare savings accounts, make it more affordable, and also give employers an incentive to want to offer that to their employees. So my bill will just expand on that, and it will allow every individual, employers right now can deduct in a group plan, a qualified plan, they can deduct their portion of the premium. It would allow the employees and individuals to be able to deduct their portion of health care, giving them more of an incentive to want to invest in HSAs and other medical savings accounts. So thank you for bringing that up. I appreciate it. Thank you for what you're doing over in the Greene County area as well. Again, this is Congressman Steve Austria. I want to thank you all for joining me this afternoon on our live teletown hall meeting taking place. I'm in Washington, D.C. It's great to hear from you back in the district. I'll be flying back later on this evening back home to see my family in Beaver Creek in Greene County. And look forward to that. But in the meantime, it's great to hear from you. And press star 3 on your phone. If you want to ask a question or make a comment, I'd love to hear from you. Just a reminder that we've got 2 offices in the district to service you. Great staff. They're there to help you in any way they can. Our Springfield District office, that phone number is 937-325-0474. And the Lancaster District office is 740-654-5149. Again, in Springfield and Lancaster are 2 district offices. Also, you can go to our webpage at austria.house.gov. We got a lot of good information there, including a link to healthcare. And encourage you to participate in our healthcare survey so I can hear from you from that perspective, as well as our email newsletter. Sign up for that if you're on our website at austria.house.gov. or today you can just press number 5 on your phone and it'll automatically sign you up for our newsletter. We send that out weekly, email to you weekly, and it keeps you up to date as to what's happening in Washington and in the district. So, again, thank you for participating. Right now, I'm going to update you on our poll numbers. We're polling the district to find out what your biggest concern is. If you think it's government or public option, press 1. If you think it's the cost of the taxpayers, press 2. If you think it's rationing and reduction of health care services, press 3. If you think it's doctor-patient relationship, press 4. Right now, our numbers are, most of you think it's the rationing of Medicare, the concern about what's going to happen to Medicare with these health care reform bills. 41% of you, 35% of you believe it's the government public option, 16% believe it's the cost of the taxpayers, and 8% believe that doctor-patient relationship is extremely important and concerned you could lose that. So thank you for participating in that. We've got literally hundreds of people who have participated, maybe even more than that on the survey so far, and we want to hear from you. Again, star 3 give you a chance to ask a question. We're getting down to the end of our hour that's allotted to us, so we're going to go right now to Earl. Earl, thanks for joining us this afternoon. Where are you calling from, Earl?
Dickerington, Ohio.
Dickerington. Great to have you on the line. Go right ahead with your comment or your question.
Well, my most concern, beyond a doubt, is government takeover of our insurance. And I'm also concerned about all 4, but mostly the government takeover. I have retired from being a police officer, and I have government insurance. I'm concerned about that being taken away from me. I stayed with the government in particular, so I would have good insurance when I retired. I now have Aetna Medicare, and it is good insurance. And I also want to make a comment that was made earlier about something about illegal immigrants. I do not think the government should be paying for insurance for those people at all. And I think there also was another comment made about people not wanting to buy insurance and spending their money for what they want to. And I'm concerned about that.
Well, and thank you so much for your call and those comments. You hit on some very important points. One is the government option as far as health care. I think we've talked about that. Most people I talk to are opposed to that, as showing in our survey today. We can do better now. We can focus on improving the system we have right now by lowering costs, by maintaining that doctor-patient relationship. And at minimal, we should be ensuring that Medicare is protected. I think that's very important. I also want to thank you for your service as a police officer. And you brought up the illegal immigration part of it. In my opinion, illegal immigrants should not be covered under this health care reform proposal. And it's very unclear in this bill whether they are or not. When you hear figures that are being thrown out there as to how many people we're going to be covering now that are uninsured, some of those figures certainly indicate that we are going to be covering illegal immigrants if we're not careful. So it's important that we be responsible, that we do this right. It's important that we have clear language, specific language, dealing with illegal immigration in this bill. Right now, it's unclear in this bill as to who's covered, who's not. And my concern is that we are going to have a small little commission or a czar that's going to be determining who is covered and who's not, and how this bill is implemented. And that concerns me as a congressman. As a congressman, I should be able to know what's in that bill, have specific language, understand what I'm voting on. And I signed a pledge that I don't have a chance to read that bill before I vote on it. I'm not going to vote on it because I'm outraged that we've been forced to vote on bills like the stimulus package, like the energy bill amendment, that we haven't had a chance to read. But again, this is Congressman Steve Austria. I know we're running out of time today. I want to thank all of you who have participated and stayed with us today on this town hall meeting. We do this regularly. These teletown hall meetings gives me an opportunity, especially when I'm in Washington, D.C., to call in the district and to hear from constituents. Reminder that I have 2 offices in the district. Please don't hesitate to call our office. We have wonderful staff who are there to help you. The Springfield District Office is 937-325-0474. Lancaster District Office is 740-654-5149. Or go to my website at austria.health.gov. We've got a healthcare link there to keep you up to date. Or just press number 5 right now on your phone. Signing up to our email newsletter. We can keep you up to date as to what's going on in Washington, D.C. with this healthcare, and keep you up to date with the healthcare reform debate. Unfortunately, our hour has come to an end. But again, I want to hear from you. It's very important. I thank you for participating in this afternoon's live teletown hall meeting and look forward to seeing you in the district. Thank you.